Thank you, everyone. Welcome, welcome, welcome. I'm Holly Rosenfink from Neighbors for Refugees, and we're so excited to have you all here for the special conversation with some of our partners and friends about the current situation for refugees in light of COVID-19. Just to tell you just a bit about Neighbors for Refugees, because we do want to focus on the conversation at hand. Neighbors for Refugees is a refugee resettlement conversation. We're a 501c3. Our mission is to help refugees, asylees, and other new Americans build a better life here and abroad by providing resources for resiliency and acculturation. Today, we're joined by 6 members of humanitarian organizations to shed light on the current crisis's impact on refugees. These organizations are on the front lines, providing essential services to them. I'd like to briefly introduce our speakers. And if you're not a speaker, if you could please turn off your video and mute yourself. We're honored to be joined by Sarah Jane Refro from HIAS, Alan Menta from Welcome Home, Fareshta Ganjavi and Tricia McDonough Ryan from Elena's Light, Ellen Smith from Keeping Our Promise Rochester, Sally El Sadik from One World, One Love, and Samuel Heptic from Catholic Charities. Welcome, everyone, and thank you so much for coming. You're going to have the opportunity in a moment to meet everybody. But before you do, I want to tell you very briefly about our format. We'll be together for the next hour or so, and each one of our guests is going to speak about what they're doing in light of COVID-19. While you're listening, if you have a question, please type it into the chat box on the right side of the screen. In the last 10 or 15 minutes or so, we'll be answering your questions, and we'll probably be answering some of them along the way as well. We're also recording this conversation, and we'll make the link available to all of you if you want to give it to your friends, family, and colleagues later. And with that, I'm going to turn to our first speaker, Sarah Jane Refro from HIAS. Her contact details will be in the chat box, and please be sure to type in questions for her, and we'll answer them at the end of the chat. Thank you.
Thank you, Holly. We're so excited that this is happening. Thank you, everyone, for putting it together from Neighbors for Refugees. So my name is Sarah Jane Renfro, and I work with HIAS. I work in our New York City office as the Program Officer for Partnerships and Volunteer Services. I work specifically through the Wraparound Services Program, which offers extended services for refugee clients as well as asylum seekers and asylees. As many of you know, HIAS works with refugees and asylum seekers in 16 countries around the globe, as well as providing legal protection for asylum seekers, and of course, refugee resettlement here in the US in partnership with 17 affiliate partners across 11 states. So I'm going to start by giving you a little bit of the zoomed out version of our global work in light of COVID-19, and then really get nitty gritty with our work in New York City and surrounding areas. So internationally, HIAS is committed to maintaining our services while taking every precaution to keep our teams and clients safe, given that in every country we work in, there has been COVID-19 that's been found. So our clients and teams have been really trying to figure out how to continue services despite that. All offices are utilizing WhatsApp to communicate with community leaders, community workers, and protection networks to provide remote legal assistance, mental health and psychosocial support services, mitigate risk of violence against women and girls, and to monitor protection situations and human rights violations. Key protection concerns for refugees is access to cash to buy food, pay rent. In response, we've been providing cash-based assistance for clients so that they can use it however they identify as most useful for them. And then we've also been providing remote mental health and legal consultation. And then just to tell you a bit about our advocacy, we've been working with partners and networks on direct advocacy and outreach on the Hill, and been signing on to letters in support of refugees and immigrants during the crisis. We've been really focusing on stimulus payments, testing, and healthcare for our communities. And our main partners have been RCUSA, which is Refugee Council USA, and it's a coalition of 29 US-based NGOs and includes all of the 9 resettlement agencies, along with other faith organizations and secular organizations working with forcibly displaced populations. RCUSA promotes efforts to protect and welcome refugees, asylees, asylum seekers, and other folks. Okay, so now zeroing in on New York City and nearby to New York City. As you probably know, the US Refugee Resettlement Program is currently on pause, but despite this, our resettlement team has continued working with clients who arrived before the pause. This work has been really focused on ensuring that clients have continued access to food, safe living situation, and PPE. We've also been keeping in constant contact to share information about COVID-19 and resources available during the crisis. Right now, we have 21 active RMP cases, including 57 individuals. There have been cases across our affiliate partners where our clients have had COVID-19, and we've been really focused on providing resources for medical support, as well as mental health and psychosocial support as people are going through all of this, and also direct resources for food and housing as people are going through this. U.S. programs for HIAS has been really heavily fundraising for providing not only this, but also hardware for clients so they can more easily link up to classes, to caseworkers, to get more information about resources during COVID-19. And this has been happening through the help of Accenture and other corporate partners, which has been great. Also, our employment specialists in the New York City office have been working with refugees, SIVs, and asylees to help apply for unemployment, and also otherwise to help people who've lost their jobs. In particular, some HIAS clients have found work through the Westchester Refugee Initiative and Neighbors for Refugees, who've employed folks part-time to sew masks for donation to hospitals and healthcare workers. And right after I finish speaking, I'm gonna send you a couple of links for that. It's a really incredible partnership and we appreciate it so much. It's been such a cool example of the New York community coming together and support refugees and healthcare workers. Also, our legal team, and don't worry, I'm watching the time, I won't speak too much. Our legal team has continued conducting monthly intakes for new clients, providing pro bono legal representation to asylum seekers. Since the beginning of all of this, the team that I work for, the Wraparound Services team, has created a program to provide assistance to asylum seekers who are generally unable to access other programs and public benefits. So the pro bono lawyers and HIAS legal staff have referred clients to us, and then we conduct intakes to understand how best clients can be supported. So far, we're supporting 31 families, and thanks to the incredible support of HIAS's New York-based volunteers who conducted a ton of research to find out what resources are still available for clients in their areas, including food banks, housing options, legal resources, and more. And particularly through the work of 2 volunteers, we were able to provide clients with gift cards for emergency food and other basic needs, as well as we've been able to provide grocery delivery through Amazon gift cards that people donated, and then we were able to use that for Whole Foods, which was interesting. It took a lot of work to access those delivery slots, but it worked. So we didn't use volunteers in New York City to do deliveries because we were concerned about safety, because a lot of people in New York City don't have personal transportation. So instead we went with the grocery delivery and gift card mechanism. One example of this is a client who's a single mother with 2 young children. She was referred to us by her pro bono lawyer because she couldn't pay for food or rent. And including for that day, she didn't have food. So we went ahead and sent her food from Uber Eats. We'd been donated some funds there, and then referred her to New York City public schools, which are providing free meals a day during the work week. And then also she's been getting support more recently from an organization that we partner with, and we're about to process an application for her to receive emergency cash assistance. And I'll talk more about that in a second. So volunteers have also continued supporting our clients through career mentorship and English tutoring, which has been amazing to be able to do that virtually. Also, a lot of clients have asked for help filing applications for unemployment, and for folks who don't qualify for employment services, our volunteers have kindly been supportive of helping people go through that process. And then recently we won grants from New York Community Trust, the Robin Hood Foundation, and UJA, which was so amazing, and we really appreciate it. Basically, what we're doing right now, and we're still in the beginning stages of this, is we're able to provide direct deposits, and if clients don't have bank accounts, we can use Western Union to give $1,000 or $1,500, depending on family size, for food, rent, and other basic necessities. It's been an incredible opportunity to provide cash assistance for people who need to pay their bills. And an example of this is that we're working with a legal client who's living with his son in a shelter. Although he doesn't have to pay for rent, he only gets limited food from the shelter. And we were able to refer him to food banks, but also help him through cash assistance. And then finally, I just wanted to let you know a few ways to get involved. So I'm gonna send some links in the chat. Thank you so much, everyone.
Thank you so much, Sarah Jane. I'd like everyone to now be introduced to Alan from Welcome Home. He's the founder of Welcome Home, based in Jersey City, and he's going to tell us some just a little bit about the many, many, many things he does.
Yeah, I'll try to keep it short, but thank you so much, Holly. Thanks to all of you here from Neighbors for Refugees and our other allies who are on the call. I've worked with many of you, and it's nice to see you. So Welcome Home, in brief, was started in 2016 as a community-based organization to provide extended support for the refugees who are resettled in Jersey City and also neighboring communities in Bayonne, Union City. In 2018, we became a 501c3 nonprofit, and we've really come to focus our attention specifically on educational and employment matters and general material support for families who are experiencing emergencies. Since the pandemic in March, we've focused our attention in 3 general areas for the 50 families that we serve actively. Communication, food and cash, and distance learning for the children. So we use a WhatsApp group to communicate information about the pandemic, about public policy around the pandemic, about resources that are available from other organizations and from the city, and to communicate news about what we're doing at Welcome Home, specifically our online meetings and various deliveries that might be made. We also use our weekly meeting that we call Virtual Fun Club, which is a Zoom meeting where we bring together as many of our clients and also volunteers as we can to keep the feeling of community and open communication alive, and also to continue giving information about what's going on face to face, and provide an opportunity for the children to come together, even as they used to come together in a church once a week. Now we're coming together on Zoom. And we also have a virtual ESL classroom that follows our meeting with the children for the adults to continue learning English in a classroom setting. It's been a great experience, actually. So as far as providing food and cash, we have come into a relationship with the Jersey City Division of Immigrant Affairs, who have very kindly taken on food distribution for us in Jersey City. And they use qualified delivery people to deliver culturally appropriate food meal boxes that are generally weigh about 40 pounds. So 40 pounds every 2 weeks for a household of 4, or twice as much for larger households. And that's been working really well for us. That's expected to continue at least through June. And we're very grateful to the city for doing that. The city has also provided hotspots for us, for the families who did not have a Wi-Fi connection prior to March, and were not able to come up with a plan with Comcast or one of the other providers. We have taken up the delivery of food in neighboring towns like Bayonne, and we have specific procedures in place for the 2 volunteers who make the food deliveries, where distancing is strictly enforced and there's no contact with the families that we deliver to. We've also been providing financial support for the families, mostly as a bridge between the current immediate situation and the time where we expect most families to begin getting public services such as TANF and SNAP, and unemployment insurance if those families apply, as well as stimulus checks. To that end, thus far, we've dispersed $9,000 worth of checks. And I want to thank Neighbors for Refugees, who gave us a very generous block grant to help us towards that. We expect to disperse another $10,000 next month again, to the families who are in greatest need. We're continually looking to our neighboring organizations and to especially faith organizations, the churches and synagogues in the area to support us. I guess the other major initiative that I want to describe briefly is our efforts to facilitate distance learning for the children and the families we serve. Jersey City is about 10,000 Chromebooks short of being able to provide each student with a Chromebook to engage in online learning. So the first thing that we did in mid-March was to start a drive for Chromebooks and tablets to distribute to our families. And we've distributed 60 of them. Most of our school children now have a device that they can use to connect to their teachers and eventually to do full-fledged online learning in the public school system. We anticipate developing a curriculum that will last through the summer, where we can teach computer literacy to the parents and to adults in general who are our clients, so that they can become more sophisticated in the ways of navigating applications like Zoom and Google Classrooms, but the portals for unemployment insurance and SNAP and all the public services that they depend on. As we know, recipients of SNAP have to re-register every week, and so it's really imperative that our clients develop some facility in computer skills. And that's that pretty much covers what we've been focused on in the last couple of months. I'm happy to take any questions, and of course welcome any kind of participation from folks who'd like to volunteer. We like to set up relationships between volunteers and clients as much as possible, especially so that the children get support with homework. And that's about all I have.
Thank you so much, Alan.
Mm-hmm.
We do have a few questions, but we're going to wait until all of you speak so we can have all of you answer them for us. Now we're going to hear from Fareshta Ganjavi, founder and executive director of Elena's Light, and Tricia McDonough-Ryan, PhD and clinical psychologist. Thank you.
Hi, everyone. Okay, I made a quick PowerPoint I would like to share with you. I'm going to share a screen. I hope it not distract any of you, but okay. Everyone can see the PowerPoint? Okay. Salam. Welcome. Ahlan bekum. Share Raslet. Khosh Amaded. This is Fareshta Ganjavi. I'm founder of Elena's Light, and I came myself as a refugee with my mother to the US in 2011. I'm happy to be here and talk about my organization and how I'm trying to serve the community. Okay, at Elena's Light, we are trying to work and help with the women and children, all the family members, to have a better future for themselves. We became a 501c in 2019, but we start our work since 2017. We are located in New Haven County, Connecticut. New Haven County is one of the largest refugee community, and so far welcoming 1,500 individuals and families since the past 5 years to the community. It's a big group of population. At Elena's Light, we are trying to serve 45 families including 300 individuals who are in most needed. Mostly our focus is on women and children. We are serving with in-home ESL tutoring for the individual and the family members who have disabled kids and cannot go out or cannot get access to the ESL classes out of the door. We bring tutors to their homes to teach them. Also, we are working with help them to get driving permit tests. Most of the family and community, especially the women we have, they need these classes to get driving permit in English and then able to find the jobs or helping their kids to go to the doctor appointments. We also have healthcare classes and educational classes. It's in home setting all. We also have cultural assimilation events to exchange the culture between the community and also between refugee and immigrant families. We are partnering with several community givers around the area to transfer the goods when they want to send it to the families. Okay, when COVID-19 happens, there was several changes in our program. Immediately, we changed all of our classes. We transfer them online classes. We use platform WhatsApp, and recently we are working on connecting them all with Zooms. We start transferring the hygiene kits to the families, masks to the families. We send COVID-19 educational packages to the families, we translated to their own languages, which mainly is Arabic, Farsi, Dari, and Pashto. We send cleaning and healthcare products to these 45 families. Also, we delivered food and diaper to 270 individuals. As my other colleagues said, some of them delivered it because it's hard to deliver all of them at this COVID-19 time. We met them all at the big parking lot, and the people who had car, we put it in their cars. The people who didn't have car, we delivered to their houses. We are starting employed women who are working with us and give them the materials. They are starting to do the mask. The mask they made, also we send it to the community. We are starting to transfer them to the refugee immigrant families. Then we are working to give it to the other healthcare settings. We are working with Dr. Ryan to creating a program called Child Social Emotional Wellness Program. I would like to, if it's possible, Dr. Ryan can explain more about this program.
Sure, thank you, Fareshte. So what we are learning has been much more significant in light of COVID is the isolation the kids are feeling, because they are already, very limited in their resources, even from the schools going into this in terms of social emotional support. So we are in the process of developing a program that will launch this summer for the kiddos who are part of Elena's Light, the school-age kids, to provide social emotional programming, a curriculum that will really hone in on helping them to develop skills to express themselves, to learn strategies on how to cope, to engage in kind of that some of the higher order problem solving that they need some coaching on and attention to, and to really help them try to feel more connected. So connecting with each other, we're working on ways in partnership with other groups on how to do this to help these kids feel connected with each other, It was interesting, when we launched this mask making program at the very beginning, it was kids in other counties making masks for the refugee kids. So what we are really hoping is to really leverage an opportunity to use other kids in other communities to help provide partnership with these kiddos and to help them integrate and feel like they are part of one community. So we'll roll this out this summer, but that's just the beginning. So we just kind of see the summer program as getting our foot in the door to build some trust and to start initiating emotional healing. And then this will carry on throughout the school year and so on. So COVID has highlighted the need for this. We know the need has always been there, but it's definitely brought it to light, and the need for us to all take charge to create systems for these kiddos. This is really going to help us to identify any kids and family systems that are currently at high risk to get them individual attention. So we are really looking forward to it, and we would love any support, guidance from our co-presenters here on lessons learned. We're leaning into other organizations on lessons learned and what they're doing and how they're modifying social emotional leadership well-being programs in light of COVID to online learning. I'll turn it back to you, Freshte.
Thank you. Now we are here. How can you help? With donating to our mask project that will keep our refugee women's employed, donating for computers for kids, to learning online classes, also donating 300 or any, like that's an example, any amount you can for a single mom to pay for the housing and also food. Donating to pay for translator. And the last one, which is very important for us, to do marketing help, visit our website and spread the word. Here, we are working with several other organizations, and I would like to thank them all. I just listed some of the organizations helping with me during this process. I'm not gonna name them, you can see them. Thank you so much for everyone for the support. And as Dr. Ryan said, we are at the beginning of our road. Always we need your help to grow and to help our community. We are open to any question you have. Feel free to ask it here or send us an email. We are always try to find a way to help our community. Looking for partnership and help from others. Thank you so much.
Thank you so much. Fareshta, before we continue, actually, Catherine Parker, who's a local government official in Westchester, has a question for you. Actually, for both of you and Tricia, what does a social emotional well-being summer program look in light of COVID?
Dr. Ryan can explain it more. Sure. That's a great question, because that's what we're grappling with now, right? So it's providing a curriculum online, or depending upon how much the loosening of any restrictions, any mentoring that's done more one-on-one within whatever kind of social distancing requirements are put in place. So the curriculum will include looking at how we can get the kids to do everything from understanding and developing confidence in their body, to trying to integrate some yoga, to integrate some art, to integrate workbooks on feelings and have this done in a platform that we can deliver it to small, into family systems, because each of these families, some families have up to 8 or 9 kids, and some are smaller. And so we want to leverage other ways other organizations are doing online learning, as well as other expertise to bring in on full, the whole person healing for the kiddos. And it's going to be definitely challenging, and we're going to have a lot of lessons we learn as we go along the way. We are developing an 8-week program for the kids to start after they finish their school year. But most of these kids right now, what they're getting is just workbooks from school. They're not really getting online interactive classes. And so what we want to try to do is have more interaction with them, even if it's online. It's not just distributing handbooks to them. It's really trying to guide them. And what Elena's Light offers is an opportunity to pilot something small in anticipation that we may have to be doing things more into the fall, and then to replicate that more and offer that more to other communities. Did that answer your question, Kate?
Actually, Catherine Parker.
Oh, Catherine Parker, yeah.
And she's muted.
Okay.
But Catherine, you can reply in the chat box. And it's an honor to have you here, Catherine Parker. I'm sure all of you know she's an important legislator here in Westchester, and she's a huge advocate of Neighbors for Refugees and Westchester Refugee Initiative and all of the organizations here. I'd like to next welcome Ellen Smith from Keeping Our Promise. She's program director. And here you are, Ellen. Thank you.
Hey everyone, and thank you for this. I really appreciate the time to explain what we're doing. Our organization focuses on SIV resettlement, and these are wartime allies who worked for the US military or USAID, Army Corps of Engineers in Afghanistan and Iraq. And we started in 2014 by helping an Army captain in Syracuse resettle his 2 interpreters from Afghanistan. And it kind of blossomed from there, where I was asked to help someone else and someone else. And then we basically, in October 2014, decided that we would develop sort of this model SIV refugee program here in Rochester, New York, and change the way resettlement was done for families. So to give you a brief overview of what we do is Catholic Family Center is the primary resettlement agency, and we have an MOU with them to resettle the SIV population. And we will pay their first month's rent and their security and get their first food for them. We will buy them a phone, and we will get every family a computer that they have upon arrival. And then we take their welcome money and we help them budget it, their welcome grant, and budget it out over a year so they can pay their utilities and their phone bill and for their non-food items. We also partner with the local Junior League Diaper Bank, but we also have a grant from the LDS Church to help with diapers and personal hygiene items every month, and also help with food. And we partner with a couple local temples for volunteers. A local temple helps us with our annual fundraiser. And we have over almost 300 volunteers in our program that help with our families. To date, we've resettled 118 families and over 350 individuals in the Rochester area from Afghanistan and Iraq, and from some refugee areas, Turkey, and some who were refugees in Germany as well. In terms of how the current COVID crisis has affected us, I mean, the big thing was we saw a huge job loss in March. And many of the families made mistakes when filing for unemployment. So if they were laid off, or what they said on their unemployment application was, well, no, we're not ready and willing, able to work because we're going to go back to work. So we had a lot of rejected applications because they didn't get help on figuring out like how to answer some of these questions. So we explained to them they still had to look for work. So we were able to have some of those redone. We also did not understand that they had to apply for unemployment, get rejected, and reapply for the pandemic unemployment insurance. So we're in the second round of applications for unemployment for many of our families. And then unknowingly, we had families reapply, and we helped them reapply for DSS while they didn't have these benefits. And then they've been rejected because they first must be rejected from unemployment and the pandemic unemployment before they can get DSS. So, I mean, it's been a learning experience for us as well on what's going on with what these families have to deal with. So this last, 6 to 8 weeks, we've paid 22 rents with help from Neighbors for Refugees and Hearts and Homes for Refugees. We had to cancel our annual fundraiser on March 18th. So we were very short funds, and we were able to get grants from other organizations around the state to help us with the families up here. So we've also helped with 6 electric bills. The other thing we're helping with is car insurance. We have a program here called Wheels for Work, and we will purchase a modest vehicle for families who have 50 hours of volunteer time back into the community. And they have to have a job or the promise of a job. And this Wheels to Work program has been a game changer in terms of the success of our families and also helping families through this COVID problem. The guys who have had cars have been able to go over into Grubhub deliveries, and I don't remember what it's called, but you can use your private car to deliver Amazon packages for Amazon. So they've been able to pick up work doing those deliveries because they had cars from our program. So actually, those with cars have been doing okay. I mean, they've been able to survive through this. The other thing that we did starting March 10th, when we understood what this pandemic was about, and before it was declared a pandemic, we reached out to families on hand washing and sanitizing with information in Pashto and Dari. And we have a Facebook page dedicated to our SIV families here in Rochester that they all use and check in on almost daily. So we have a couple of doctors, they were doctors in Afghanistan who are here now. So they're helping with health issues and making sure that everyone understands social distancing and how to be safe. And then the other thing that I like to remind people, when we talk about a 6-foot distance, many of our families, refugees and SIVs, don't understand feet. And so as I remind everyone, tell them that they need to stay 2 meters apart or 1.8 meters apart. They understand that better than 6 feet. So that's just a reminder for everyone. Because our families do have computers, the kids are able to participate in school. They were also given Chromebooks by our school, but for children who are 6th grade and up. But I did hear the other day that there is a low participation of children on Zoom meetings. So that's something that we need to take care of up here. The other thing that we have had for the last 6 years is we offer horseback riding for refugee children. And I think that it's a really important part to help them overcome fears, gain self-confidence, learn that if they can control a 1,000-pound animal, that they can control other things in their life. And of course, horses are a big part of culture for Afghanistan and Iraqis both. So unfortunately, our summer camp for horseback riding has been canceled, but we were just told today by New York State that horseback riding lessons are permitted. So but I don't know that we can get the grant money back for that because of COVID. And I just don't know. The other thing that was discussed today that we're going to start looking into is, as everyone has heard about the horrific attack on the hospital the other day in Kabul, the women's hospital. And today there was another large suicide attack, a suicide bomber. And when you think things can't get any worse in Afghanistan, they are getting worse, and Afghans cannot get out, of course, to get here. Unlike refugees, the SIVs are not on pause. So if they can get a flight out of Kabul, they can come here, but there are no flights leaving Kabul right now, so they can't get out. And I see a lot of stress in our families here because first they're self-quarantining because of COVID. They're feeling helpless there. And then they see the things that are happening in Afghanistan, and there's nothing they can do to help. So I was on the phone this morning, and we're going to try to find a psychologist to lead a Zoom meeting among our SIV families from Afghanistan on what they're feeling, whether, and how those feelings of helplessness are normal. Sleeplessness will be normal during these times, and what they can expect so they don't think that they're going crazy during these really horrific times for their country, where they're having a hard time healing. So you can find us, and I'm sorry I don't have screenshots, but keepingourpromise.org on the web, if that was, I'm hoping it wasn't backwards. But, as far as like how we're gonna continue, I'm hoping that by June, our families will have their unemployment, their pandemic insurance. We've helped the families who did not work last year file for the non-taxpayer form so they could get the $1,200 per person, $500 per child pandemic money. And again, we're telling them, don't go out and spend it, but save this so you can plan and budget out for the future, because we don't know exactly what the future brings. And the other thing up here in Rochester is, as of tomorrow, we are allowed to start to go back to work under this phase 1. And I believe we're one of the first areas, the Finger Lake region in New York State, that can do that. So I'm hoping that that will get some of our families back to work. So that's what I have. Thank you.
Thank you so much, Ellen. That was so informative and amazing work. Thank you so much. Our next speaker is Sally El-Sedek from One World, One Love. And Sally, take it. Thank you.
Hi, Holly. Thank you so much. And thank you everyone for being here and everybody who's shared so far. It's incredible to hear about the work that's continues to be done to support displaced persons, refugees, SIVs, asylum seekers during COVID. Just to tell you a little bit about One World, One Love. We started in 2016, right before the election, as a simple call for donations to help Syrian refugees at the time. That crisis was hitting national consciousness. And, we, over the days and weeks that followed, we received tremendous support. Hundreds of people reached out to us and wanted to help. They were offering to host families in their homes. They wanted to assist with groceries, helping people find jobs, mentorship, friendship, and more. And so initially the idea was to provide the needed support, to perhaps connect the volunteers with resettlement agencies directly. And the way that it ended up evolving was, our volunteers did provide donations for initially Syrian refugees. Now we work with refugees from all over the world, help setting up the housing, the apartments that are secured by the resettlement agencies. Oftentimes the agencies only receive $900 and some change per person or per family. I guess it's per person. And with that, they have to secure first month's rent and security deposit. They secure 1 plate per person, 1 cup per person, one of each essential item. And anything above and beyond that they have to spend then becomes a loan that the family needs to pay back. And so what our volunteers do is we step in and we provide the initial cleaning of the apartments, and then we set them up and provide as much as we can in the form of donated goods and items, so that the resettlement agency that we work with, which is primarily International Rescue Committee, can use the funds to secure the absolute necessities and minimize or eliminate the amount of money that the family would then have to pay back. So as I mentioned before, we now work with International Rescue Committee as our primary resettlement agency partner. And we provide the apartment setups and cleanings. We provide donation of clothing and household items, especially around the change of seasons. We work with families, because as the children especially grow, each season shift, they need new items. We also have an intergenerational enrichment and literacy program that we run, and social events that we do, picnics, outings to museums, beach days, things like that. So over the years, we've worked with 136 families, over 500 individuals. We have over 1,800 volunteers from around the state of New Jersey and beyond. We have volunteers from all over the country, and especially now in the COVID environment, we have people, even more volunteers coming from around the country and from around the world to support our work. Since the crisis has hit, we mobilized our volunteers and have been in ongoing contact with about 88 families. Initially it was just to outreach and make sure that they knew that they weren't alone, to explain the situation, what was happening with the virus, how to stay safe and healthy to protect their families, social distancing, what to do in the event that somebody in the family did fall ill. And as the weeks progressed, we helped with assistance navigating the school shutdowns, how to access food through food pantries, through hot meal distribution centers. We also delivered food and other needed items, hygiene supplies, activities for kids, laptops, directly to about 17 families through no contact delivery. And then we also are part of a coalition, which includes IRC, Westfield Fun Club, Cornerstone Counseling, and Refugee Assistance Partners. And through this network, we provide a number of different services, one of which is a bi-weekly food donation delivery system that is coordinated and run primarily by Westfield Fun Club, and all of the other sister organizations funnel donations to them, refer families, and also family members who are willing to do deliveries are able to be hired and paid a small stipend, to help with finances during this time. So we've also supplied cash donations to about 14 families, 15 families actually directly, including the donation from Holly and Neighbors for Refugees. Thank you for that. We were able to provide them to them to help with rent, bills, and other needed items. In terms of how COVID has impacted our families, with loss of income, with the increased isolation that's happening with the social distancing. We're doing the best that we can with our network to maintain ongoing contact. We've connected some of our families to Cornerstone Counseling that provides the online WhatsApp groups so that they can have ongoing social connection through the crisis. And then our plan is to relaunch our enrichment program and literacy program online as well, once we have, the management system and the resources in place to make that happen. We continue to supply critical items to families in need and to communicate using our network of volunteers throughout the state. The the important thing for us here is to make sure that, critical needs are met, to make sure that we are coordinating with our sister organizations in our area so that nobody falls through the cracks, and that resources are utilized to the best effect, because resources really are dwindling in our space right now. If you want to learn more about how you can help, you can join our Facebook group, One World, One Love. You can also visit us at oneworldonelovenj.org to find out more about the activities that we're involved in now and long term.
Sally, thank you so much. It's really wonderful to hear what all of you are doing on the ground. Our next speaker is Samuel Heptig. He's Resettlement Supervisor at Catholic Charities. Thank you, Sam.
Well, yes, hello, and then I can give a brief update on some of what we're doing north of New York and sort of in the state, and then I'm sure Kelly, the director from New York City, can give some more specifics about there. But just initially, sort of similar to Highest, we'll start at a larger level. So, of course, Catholic Charities does have sort of the double-edged sword of we are a larger organization, so we have more resources to draw on. But at the same time, we have a lot more people who are dependent and look to those services. So we do have a lot of difficulties right now. Similar to everyone else, we've seen a lot of layoffs with COVID. We've seen a lot of our clients struggling. So we're really doing a lot of advocacy work, working, and this is a national level, working with Justice for Immigrants, with our parent organization, of USCCB. So really trying to advocate for, on a federal and a larger level, for different things to come down and really help these clients. And then more specific to New York, Catholic Charities still runs the ONA hotline, which is a hotline for immigration, any kind of questions, legal services, and other things to be connected to different agencies across the entire state. Even though we are partially working from home, we still have people going in. So that hotline is still manned 24/7 for anybody who has any of those questions. So in specifically more toward our area in the New York region and north of the city, we've been doing a lot of exactly what everyone is mentioning, really reaching out to a lot of our community groups. We work very closely with, I know Holly, you mentioned the Westchester Refugee Initiative. And those partners, they've been incredibly supportive. We've been able to draw in toiletry donations for our clients, as well as a number of thousands of dollars in gift cards that we've been distributing slowly, specifically trying to target those clients who are not eligible or were left out of the federal stimulus or the other supports. There are a lot of people who fell through the gaps that we've really been trying to step in and so support them who are the most economically vulnerable during these times. Again, it seems like I'm repeating myself, but we're doing a lot of the same outreach. We're gathering diapers. We work with different nonprofits and also Feeding Westchester, the food pantries, and other organizations to try to keep up with the need. We have multiple distributions each week. We have 4 different sites that our office is trying to help coordinate. And even, I can tell you, even yesterday, in one day, in coordination with the St. Peter's School, we gave 520 families received food, and they were still people left in line. So we are really doing our best to reach out during these times and gather everything we can, applying to different grants. We also have a women's sewing group that we were able to connect with fabric donations and other things. We were able to actually have a partnership with the Hudson Valley Medical Center. And so the women actually, I believe this week they completed it, in order of 1,000 masks were delivered to them. And so they were really, I mean, they're not PPE exactly, but it really helps the volunteers and all the medical, all the people in the medical field. And we're working, and like I said, we're really trying to focus on those who have fallen through the gaps. I'm talking about more. And Kelly, if you want to speak a little bit more about all the people who haven't fallen through the gaps, but we're still helping incredibly.
Great. Thank you so much, Sam. I don't want to take too much time, but Sam would also not be bold enough to say that he's literally the person out there unpacking pallets of food and putting together bags of food. So Don't let his modesty throw you off. But thank you so much for that. I just mentioned a few more things. We've been fortunate to get some significant donations from various anonymous donors, but then is funneled through the New York Community Trust. So we are really, I'm happy that that is focused on really getting dollars into people's hands, because people know best what they need. And so we have, over a series of the past couple of weeks, already given out about $250,000 to our clients in the Immigrant and Refugee Services Division in cash cards. And we're not done yet, so that's continuing. And that's usually accompanied by like a food pop-up to also give a balanced, nutritious, 3 bags of food that goes to everyone that wants it. We've experienced massive job losses. So, we're working just individually with every single person that we can to either connect them with unemployment insurance, get them another job. There are still some people who are miraculously finding jobs. So we're working on all of that. And just some of the challenges that we haven't quite touched on, the issues with the courts. They are still working on detained cases, but there are people who are really confused about their asylum court hearings and what is happening with that. Even for people who are more recently granted asylum, they're encountering a lot of challenges. Social Security offices are closed. So there's just kind of a lot of barriers to even accessing some of the next sorts of benefits that they should be getting. And also we're really concerned with the border closures at the southern border affecting children being turned back automatically. A few other things just in terms of advocacy that we are kind of standing for at this time is, again, all of these folks that are fallen through the gaps of the CARES Act, people who don't qualify for one reason or another. Many of our more recently arrived clients or recently granted clients are not able to apply for unemployment insurance if they had never worked yet. Also just really focusing on, as Sam mentioned, the populations out. I mean, New York City is struggling a lot, but there have been some resources and some larger scale donations, but the folks, just north of the city, or the folks that we might work with in Long Island, or, further up in the Hudson Valley, are really left out and are also really struggling. So we'd like to see, more attention to those folks. As everybody mentioned, again, the devices are super useful, and that's another area where New York City has been fortunate, with a few hiccups, but all of the kids were able to get iPads if they had applied for them, hopefully by now. But it's district by district in other places, and there's not the same amount of coverage. We'd also, really like to highlight that our clients are also, obviously they're workers and they need protection with proper PPE, proper workforce protection, ideally hazard pay. So these are the types of things that we could be pushing for. And just also keeping in mind that, we are seeing an uptick in more domestic violence and potentially more issues with, child abuse. So we have to be really vigilant and support our families that, or anyone that is experiencing those kinds of struggles while they're in quarantine, because we know that definitely increases with this stress of the situation. So yeah, I mean, mostly I just want to highlight again that, this is in a public health crisis. It doesn't matter what your immigration status is. We all need to be protected. So this is another area where, the virus is not going to be checking your I-94 or your employment authorization document. We all need to kind of take care of each other and make sure people are protected and safe. And it highlights the need for that even more. So thank you for this forum and for sharing and for all of the work that everyone has done and for letting us have a few minutes here. Thanks so much.
Thank you so much, Kelly and Sam. We are right at the 2 o'clock times, so I think we'll have to end here, but we are going to leave the chat box open for another minute if any of you want to respond to any of the questions or ask questions, and we can help you get in touch with the speakers. So I just want to send all of our wonderful speakers an incredibly big thank you. Thank you so much for sharing so much of your so much about your organizations with us. I want to thank you, some of the people from Neighbors for Refugees who work behind the scenes with me today. Elaine, Bob, and Frank, and Rania, and Ruth, thank you so much. And I hope this is the beginning of many, many more conversations together, because I really feel that this collaboration, the sharing of information will help all of us do wonderful things together. So thank you so much, and everyone have a good day. Thank you. Bye-bye.
Holly.